true measure of a nation's greatness is not its wealth of infrastructure, but the character, health, and sobriety of its youth. Few statements better reflect Nigeria's reality today. Nigeria's youthful population should be its greatest asset. Instead, it is increasingly threatened by a drug abuse epidemic that is destroying lives, weakening families, fueling crime, and undermining national development. With an estimated 14.3 million Nigerians aged 15 to 64 using illicit substances, nearly 3 times the global average, the crisis has become a national emergency. Even more alarming is the falling age of first exposure. Children as young as 10 are experimenting with drugs, while many secondary school and university students are slipping into addiction driven by peer pressure, curiosity, academic stress, poor parental supervision, and emotional neglect. What begins as experimentation often ends in lifelong dependency. The consequences are devastating. Drug abuse fuels violence, cultism, theft, sexual assault, mental illness, school dropout, poor academic performance, and suicide. It also places enormous pressure on families, healthcare systems, and national security. Medical experts warn that adolescent drug use permanently alters brain development, increasing the risk of mental disorder, cognitive impairment, and chronic addiction. Beyond the health risks, legal consequences are severe. Nigeria's drug laws impose lengthy prison terms for possession and life imprisonment for major trafficking offenses, with offenders also facing the forfeiture of illicitly acquired assets. Cannabis, tramadol, codeine-based syrups, cocaine, methamphetamine, and synthetic opioids continue to flood communities despite increased enforcement, highlighting the sophistication of criminal networks behind illicit drug trade. The solution must go beyond arrests. Parents must engage their children. Schools should strengthen drug education. Governments must expand rehabilitation services and mental health care, while communities must embrace prevention as vigorously as enforcement. For nearly a decade, the Association of Community Pharmacists of Nigeria, ACPN, has led this effort through its national anti-drug abuse competition, empowering thousands of secondary school students to promote drug-free living through debates, essays, poetry, and advocacy. Under the leadership of pharmacist Ambrose Eze, the initiative has grown significantly. This year's competition moves beyond awareness by requiring participating schools to establish functional anti-substance abuse clubs and implement measurable community-based prevention programs, with outstanding schools advancing to national presentations. The message is simple. Nigeria cannot arrest its way out of the drug epidemic. It must educate, empower, and protect its young people before addiction takes hold. Every parent, teacher, school proprietor, community leader, and policymaker has a role to play by investing in prevention and strengthening school-based interventions. Nigeria can safeguard its youth and secure a healthier, safer, and more prosperous future. A drug-free generation is not just an aspiration, it is the foundation of a stronger Nigeria.